Hello, this is Dr. Lowe, dictating the first of the voiceovers for the PowerPoints on the second food to fuel case. The first slide is just a review of normal histology. In the small intestine at the left you can see villi, some cells in the lamina propria and some goblet cells, and then at the bottom the muscularis mucosa. The colon on the right, this is a lower magnification, but you see that there are no villi. The crypts are longer and more uniform. There is a very thin muscularis mucosa, submucosa, muscularis propria, and down at the bottom here, the subserosa. Review of the functions of the intestines, basically digestion and absorption of nutrients. This happens proximally. The distal intestine, including the colon, really reclaim fluid and electrolytes. This is all review so far. For the first case, the diarrhea, this is a definition of diarrhea, which is increased volume and usually liquid stool. Physiologically, there are 4 different types of diarrhea. Secretory diarrhea, this is isotonic stool, persists during fasting. Osmotic diarrhea occurs when there is some undigested nutrient, such as with lactase deficiency, and it's due to excessive osmotic forces. This is hypertonic stool and stops if the patient stops eating. Malabsorptive diarrhea also results from failure of nutrient absorption, usually with steatorrhea, and again is relieved by fasting. Exudative diarrhea is due to inflammatory disease, usually infectious, and has purulent bloody stools and continue during fasting. Next slide, malabsorption and chronic diarrhea. Malabsorption is defective absorption of essential nutrients, which can be either defective digestion or defective absorption. Usually has chronic diarrhea, and the effects are due to the nutritional deficiencies. The first specific disease is celiac disease, probably better called gluten-sensitive enteropathy. It is a genetically determined sensitivity to gluten. Actually, it's to gliadin, deamidated gliadin. This is a protease-resistant fragment of gluten. Gluten is present in certain grains, as you know. Gluten sensitivity is relatively common, but many patients are undiagnosed and many may have minimal symptoms. The treatment is a gluten-free diet. The genetic predisposition is due to the patient's HLA types. These HLA types actually react with the deamidated gliadin and to activate T cells. This we'll see in the next slide. Here's a cartoon of the process. This happens to be from Big Robbins textbook. I think the same one is in Robbins' Basic Pathology. Here is the histology. On the left you see normal small intestine with villi. On the right you see lack of villi in gluten-sensitive enteropathy and large numbers of mononuclear cells in the lamina propria. Other causes of malabsorption include environmental enteropathy, lactase deficiency, and Whipple's disease. Environmental enteropathy, also called tropical sprue, is actually very prevalent in tropical countries. It's a common cause of malnutrition in infants and failure to thrive. The basis is poorly understood, and it has not been that well studied despite its prevalence. Histology is really non-diagnostic. Lactase or disaccharidase deficiency is fairly common. This is an acquired enzyme deficiency. People gradually lose lactase production after childhood and have osmotic diarrhea if they consume large amounts of lactase. Most patients, or many patients, will actually recognize this on their own by trial and error, and if not, it can be done by a managed controlled diet Rarely are absorption studies needed. Treatment with varied degrees of success can be done with lactase tablets. Whipple disease is another cause of chronic malabsorption. This is a rare chronic bacterial infection. I'm not going to try to pronounce the name of the organism. It's in the outline. It was originally described in the GI tract, but actually involves the CNS, heart, and joints as well. These organisms accumulate in macrophages and are PAS positive, so they stain this bright pink color with the PAS stain. Diagnosis is usually by biopsy with the PAS stain. It's one of these diseases which is very rare, but occurs quite frequently on exams, in differential diagnoses, and discussions on rounds. It is important because this is one of these diseases which you will never diagnose if you don't think of it. Much more common are the infectious enterocolitis. Most of these were covered in the host defense, host response block, or will be covered elsewhere in this block. And these are really the most common diseases of the intestines, both as acute illnesses and chronic infections. The list here is really too small to read. I'm sorry for that, but this is again the table from the Big Robins. And common bacterial causes include cholera, Campylobacter, Shigella, Salmonella, typhoid, and the various toxigenic or invasive strains of E. coli. The viral enterocolitis, rotavirus, norovirus, and cytomegalovirus. Rotavirus and norovirus are the common causes of viral enterocolitis outbreaks. These are the cruise ship outbreaks. They also occur in closed populations such as daycare centers and nursing homes. In the latter, they can actually be associated with some mortality among the frail elderly who live there. Cytomegalovirus is more sporadic and occurs among immunologically impaired patients. Parasitic causes of enterocolitis are worldwide and extremely prevalent. These include amoeba, giardia, cryptosporidia, ascaris, strongyloides, enterobius, and schistosomes. Last slide is an illustration of some of these causes from, again, a figure in the Big Robins. At the top left is a viral enterocolitis with lymphocytes in the lamina propria and in some of the glands. Second slide are ascaris and strongyloides, where you can actually see the organisms. These are multicellular parasites. Schistosomiasis is very common in tropical countries. You can see an encysted schistosome here. Also involves the urinary tract. Amoebic enterocolitis can also occur, and this can mimic inflammatory bowel disease, which we will discuss in the next section. Giardia is common, and there are outbreaks. It is seen in water supplies. It's transmitted through water. Occasionally in Colorado. At one point, Milwaukee had an outbreak of giardiasis. Cryptosporidia, sorry for that break there. You can see the organisms here as the small dots along the epithelial surface. That's all for this take.